Okay, good evening. It is almost 7 o'clock. We're going to wait just another minute before we get started and give everybody a chance to hop on this evening. My name is Kelsey Nordyke, and I am your Kansas 4-H Southeast Region 4-H Specialist, and I'm also the Kansas 4-H Ag Science Specialist, and I want to welcome you to tonight's webinar. We're going to cover some biosecurity measures for our 4-H livestock projects, and in particular looking at biosecurity for both our dairy and poultry projects as we look at the implications of avian influenza and H5N1 influenza, both being one and the same. As a reminder, as we get started, please make sure to keep your videos and your videos off and microphones muted. That just helps us to conserve the bandwidth and helps with the quality of tonight's video. We are going to record tonight's presentation. It is recording now, and we will post it to the Kansas 4-H Animal Science webinar page, which is located on the Kansas 4-H site. And we will send a reminder with that link out to you first thing tomorrow so that you have that in case you want to go back and watch any of the replay. And since it is now 7 o'clock, we're going to get started. I'd like to introduce to you Dr. Sarah McReynolds. Dr. McReynolds is the Assistant Animal Health Commissioner with the Kansas Department of Agriculture in the Division of Animal Health. If you have been a part of some of our county fair webinars or some of the livestock junior producer days, you may be somewhat familiar with Dr. McReynolds. And with that, I'm going to turn it over to Dr. McReynolds. Thank you.
Great. Thank you very much, Kelsey. And again, my name is Sarah McReynolds, and I do serve as Assistant Animal Health Commissioner with the Kansas Department of Agriculture. And Kelsey asked me to just present this evening and cover some biosecurity tips, and with new rules in place for H5N1 and dairy cattle, touch on that as well. So tonight is going to be 100% H5N1, which has been much of our life the last few months. So I am going to go ahead and cover just briefly about avian influenza affecting poultry, and hopefully everybody, especially if you are poultry owners, are aware of highly pathogenic avian influenza, and it's highly infectious. It causes sudden death loss typically, and there's certainly some other signs, but we've been dealing with or been in a current outbreak of highly pathogenic avian influenza in poultry since 2022. So it's been going on for a couple years, and unfortunately this outbreak continues, and we are continuing to have cases across the United States. Again, with highly pathogenic avian influenza in poultry, we see most of the birds die pretty quickly, a pretty dramatic death loss in a flock that are impacted with highly pathogenic avian influenza. A reminder, hopefully everybody's aware, but avian influenza, our exposure comes from migratory waterfowl. So I mentioned in the domesticated poultry, that's a high death loss, 90 to 100% of the birds within a few days. But unfortunately, the wild migratory birds, especially the waterfowl, typically don't show much or very little signs of the disease. So they are flying over, defecating, landing, and they are spreading that virus. So the biosecurity is really important, especially during that migration season, because that's where our introduction, for the most part, comes from. So if a backyard flock does get avian influenza, the ways that they can get it, fecal oral. So there's a lot of diseases that can spread that way. I already mentioned that the migratory birds, I'm sure we're all familiar with the fecal oral route. Just there's so much feces when those migratory birds are flying over. So that is by far our number one chance of introduction. It certainly can be aerosolized as well. It's a virus that in the wind's blowing, it can blow from one farm to another. So that aerosolization, it doesn't always take that nose-to-nose contact to spread it. And then we talk about fomites a lot when we're talking about biosecurity. And a fomite is just like an inanimate object that virus, in this case, but it could be a bacteria, is stuck on. And as if we don't clean things like equipment and our shoes, we can walk that virus right into our pen with our birds. So fomite's another very common way of introduction. And again, the virus is in our environment already due to migratory birds. So those birds, again, are contaminated in an environment, and then these other three ways are ways that it can get into our domesticated birds, our pet birds, and spread that virus. So now I'm going to jump. So I've been talking about avian influenza, highly pathogenic avian influenza in poultry. And then I'm going to touch on dairy cattle because we're actually talking about this exact same virus that's been affecting poultry since 2022. And then just in mid to late March, we had some reports of dairy cattle that had reported abnormal lactation. Not all the cows in the herd, but certainly a 5–10%, maybe even more, and decreased feed consumption. And with those, just through a lot of testing, trying to figure out what was going on. And with so much avian influenza in our environment, they decided to look and see if it happened to be avian influenza, and it was confirmed. So this is the exact same virus that we're talking about in poultry. Now we have affecting cattle, but there are a lot of differences because we're not having that high death loss. So same virus, but a lot of different types of what we're seeing manifestation of that disease in the different species. This is something that we also are having now an active outbreak situation. Just in the last 7 days, there's been 20 new affected herds, and this is in the entire United States. Kansas has had cases in March, but we have not had any cases in the last 30 days. 119 total positive farms. Now we're talking about dairy cattle in 12 different states. So here's a map of the current status of what we're seeing of this is the highly pathogenic avian influenza, H5N1, that we're seeing in dairy cattle. So the pink are states that are impacted and have been impacted in the last 30 days. And the cream state, which includes Kansas, are the states that were impacted over 30 days ago. So I'm gonna jump back and forth again because we're talking about the same virus, and because we've been dealing with H5N1 in poultry for 2 years, we do have some lesson learned. Things that as we're doing surveys and talking to impacted poultry producers, we're trying to figure out what are the highest risk factors of introduction? How is this getting into, especially some commercial or backyard poultry that have pretty good biosecurity in place? And what we found is the number one way we believe that introduction is coming in is through clothing or shoes. And I'm sure a lot of people can picture how this can happen. Just by walking around an environment where that virus is in the environment and without changing our shoes before walking into a backyard poultry pen or walking into a commercial poultry facility. So they really believe changing clothes and shoes can really be one of the most important biosecurity risk factor to try to prevent. Nothing's going to have no risk, but certainly important to try to prevent HPAI in poultry. The number two thing is feed spills not being cleaned up. And I'm sure you can all picture when you have spilled grain, how birds gather around, and that attracts wild birds to an environment. So by just having that feed in an environment, bringing wild birds in, and that is certainly the second highest risk. And then the third, it's certainly tied to it, but in the poultry world, having a pond or water source close by in your backyard is very high risk for HPAI. About 57% of the cases of HPAI in poultry across the United States, and just over that in Kansas, have been backyard flocks. And nearly all of those flocks had a water source in their backyard, which allowed their domesticated birds to have very close nose-to-nose contact, very close contact with wild birds. We also had 2 individuals who actually thought that they were going to take care or rescue or treat wild birds that didn't look right, acted sick. So they actually brought those home and put those in their pen with their chickens. And quickly, all those chickens died. So that direct contact with migratory waterfowl and other wildlife are very, very high risk for HPAI in poultry. So as far as biosecurity, biosecurity is certainly a habit. It's something that you really need to just get in the habit every single day, doing these steps, having to change your shoes, making sure you're not sharing equipment, always taking that time to clean equipment before it's shared, because that type of habit can help protect you. And it's not just talking about taking some extra time to do a few steps can certainly decrease your risk of getting this virus. So, and Kelsey already put it in the chat, we do have some biosecurity resources of what we've learned already in avian influenza and poultry. So here is a link of a flyer. There's other information about backyard birds and HPAI in poultry. So just because we've been dealing with this virus for many years and have been in an outbreak since 2022, we have quite a bit of information out there on steps that you can do if you're a poultry owner to try to protect your flock. Now, I'm going to jump back a little bit to dairy cattle. So I've been talking about all the lessons learned in poultry. We still are dealing with this outbreak, so we don't have everything figured out, but we certainly understand a lot about this virus in poultry. What we don't understand, and we're still learning, and I tell vet students when I talk to them, this is not something I learned about in veterinary school, H5N1 in dairy cattle. In fact, we really learned they didn't get impacted. So this is new to all of us, and we're really trying to learn a lot. So this is lessons still learning. We do not have this completely figured out. We're doing research now. They're doing research to try to understand. But what we've learned so far, as they look at this virus in dairy cattle, it shows that it's a single wild bird introduction to cattle that's a spillover event. So what this means is this is not like what we've been seeing in poultry, where we have all the migratory waterfowl and different birds are giving it each introduction, a wild bird to a poultry facility, another wild bird to a poultry facility, because a lot of them are carrying this virus. That's not what we're seeing in dairy cattle. We had one spillover event that probably was a farm that maybe had some poultry and had dairy cattle, close contact, had waterfowl there, maybe even shared a water source. Somehow a lot of virus got into an event that affected some cattle. And from there, what we're seeing in dairy cattle is it's actually being spread from cow to cow now. The wild birds are not involved in this spread that we're seeing in dairy cattle. And the virologists, all the people in the lab actually can study the genomics of this virus and tell us that. It's truly remarkable. So I think it's good news that we're not seeing wild birds spreading this to dairy cattle all across the United States, because that would be that would be very difficult to stop the spread. So we're seeing a one spillover event. So now what's happening is it's spreading from farm to farm by people or by animals. And we certainly know, which is what is also making this very challenging, is this isn't again like poultry where the birds are dying. 90% of them are dying in poultry, but we're not seeing much death loss at all in cattle. About 10% maybe of a herd are getting sick. And some of the cows, when I say asymptomatic, they're not showing any signs at all. So they completely appear healthy, but we're finding if you look at that milk, we're finding a lot of virus in the milk. And that's what's also really interesting, and it's been hard with the dairy cattle, is they're not really aerosolizing this virus like we see poultry. When they're impacted and they breathe out, there's a lot of virus particles in the air. The cattle, the virus is actually in the milk, not very much virus at all in their respiratory tract. So very different, but the highest risk in cattle is exposure to the milk, because that's where the virus is. And unfortunately, not all the cows that have this virus actually have much for clinical signs. It's a good thing for the herd. They can recover, get back to normal. But some herds, maybe 20% of them will go off milk and go off feed consumption. So the lessons we're still learning, as I said, we have over 110 premises of herds affected across the United States, 12 different states impacted. So we know this is being spread, and it's being spread all across the United States. Some certainly have been the movement of lactating dairy cows. There are some states like North Carolina and Ohio that you can actually, looking at the movements, we see a herd that didn't know they were impacted, move lactating dairy cows and then spread it to another state. So those are pretty, we can study that and say, we know how to stop future spread. We just need to not move animals from a herd that is sick. That's certainly our number one. We're also seeing in some states, and unfortunately, Colorado, a neighboring state, Idaho, Michigan, we have seen maybe sharing of equipment or personnel has also moved this virus. So that's touching on what we call that fomite again, getting some virus. Again, it's especially anybody who's maybe working in a milk parlor, walking in a milk parlor. Doesn't take much. There's a lot of virus in this milk. Not cleaning shoes, walking to another property, maybe sharing of equipment, sharing of trailers. Those type of movements appear to really be spreading this within an area. Because again, it's not the aerosolization that we have typically with poultry. So it's movement of personnel, movement of visitors, movement of equipment, and movement of animals that at this point seems to be spreading this amongst the dairy cattle. Again, a lot of lessons we're still learning. We certainly don't have this figured out, but those are the things that are rising to the top that appear to be spreading this in other states. So with that background, I want to make sure everybody's aware of some new, what we call movement restrictions that are in place for lactating dairy cattle. The Kansas Department of Agriculture, the Animal Health Commissioner, has issued an order that lactating dairy cattle, any movement off the farm, and unless it's going to slaughter, to processing, does require a certificate of veterinary inspection or a health certificate. And then your veterinarian will also call our office and get a permit number for that certificate of veterinary inspection. So this is a brand new rule because this is for any movement within the state or outside of the state. So it's not just for that movement across state lines that we typically have that health certificate requirement. This is also for movement to a fair or a show in the state of Kansas would require that certificate of veterinary inspection or a health certificate as it's commonly called. The other thing everybody needs to be aware of is USDA has issued a federal order, which their jurisdiction is any movement across state lines. So they are also requiring a certificate of veterinary inspection for any movement across state lines, which was already in place. But then they're also requiring a milk test within 7 days of that movement. So if you are going to be going to a show or exhibition out of state, you are going to be required to have the milk tested of the animals that are going to be moving within 7 days of that movement. I also want everybody to be aware that a state could have additional requirements. Minnesota, Wisconsin, Michigan, those are all states that actually have a test requirement for any animal going to a show or exhibition within their own state. They are requiring that test as well. So for anyone who maybe travels and goes to different shows, unfortunately, because this is what we call an emergent disease, we're still trying to learn what's going on. There might be different requirements in different states. So there, and hopefully with the background, you have a little understanding on what you can try to focus on for biosecurity, but it's not easy. Certainly it's never easy. And then when we have a disease that we're still learning about, and there's a lot of virus in milk, it makes it difficult. USDA has issued recommendations for exhibitions and shows, and that is on their website, which I have a link to or guidance to. And I've pulled this information off of that type of guidance. It's quite long. It's like 6 pages maybe. So I've just pulled a couple slides to hit the key points, thinking of what you can do if you're taking dairy cattle, especially lactating dairy cattle, to a show. Cleaning and disinfecting equipment is so important. And I've already touched on how we're seeing this spread. All those different ways, there are ways that a virus can come and be exposed to other animals. So anytime you're sharing equipment, make sure it's cleaned and disinfected between farms. And we highly recommend not to, if you're at a show, don't share tools, don't share feed and water with other exhibitors, and then portable milking equipment. If you are sharing milking equipment, make sure that's clean and disinfected. Again, this virus, we are seeing most of the virus in the milk, and not all the cows, unfortunately, are always showing signs of the disease. Usually some are in the herd, but maybe not all of them. So having portable or bringing your own milk equipment and not sharing equipment is really important to try to stop the spread. The other thing is avoid transporting animals from different premises in the same trailer. And we've definitely seen in other states that's how it's been spread. Lactating dairy cattle, they're often leaking a little milk. So certainly that virus can be in that trailer if you're sharing a trailer. So we highly recommend not to share a trailer. The other things is when you bring your animal back home, and this is true for any show, but certainly in this case of lactating dairy cattle, it's to isolate, observe them for a period of time to try to prevent that contact. So if they do end up getting sick, they're not exposing to all the other animals in your herd. And then utilize separate boots and clothing when you're tending to those show animals, even when you're on your own farm, just to keep that separate. Because if you isolate the animals but don't change your shoes and clothing, it's not worth it, because you're still walking possibly a virus or a bacteria back and forth. And here is a picture of the USDA guidance document they made for dairy cattle at livestock exhibition. You can Google and find that. It's on USDA's homepage, and you also can get to it from our website too. And they have a lot as far as community milking parlors. There's a lot of concern again with milking machines, milking parlors, because we're finding that virus, especially in the milk. So those are all areas to focus on as far as biosecurity and making sure you're not sharing equipment. They also have some great resources for disinfectants and other public health and resources on that webpage. And lastly, there's certainly a lot of levels of biosecurity, and we have our, people just getting started learning about caring for livestock. We have everyday, that probably a lot of you maybe already do. And then we have our enhanced. And we talk about enhanced biosecurity a lot when we talk about foreign animal diseases, outbreak situations. But just a few steps if you want more information about enhanced biosecurity plans. We do have Kelly Oliver on staff. She's our animal health planner, and that's her contact information. And she can help, especially if you have a larger operation or just want to figure out how can I set up an enhanced biosecurity plan. Doesn't mean you always have to be following it, but in times of higher risk, maybe following an enhanced biosecurity plan or just trying to learn more about it. She's a great resource. So that's what I have this evening. Kelsey, here's the link to our webpage, but I think Kelsey already put it in the chat, a direct link, which will be much easier to click on than this PowerPoint.
Wonderful. Thank you so much, Dr. McReynolds. I'm going to give everybody a chance that if you've got some questions, please be sure to put them in the chat. We do currently have one question in there, and it is, are cattle spreading the virus to poultry?
That's a very good question. Unfortunately, they are. Again, because they can study the virus and look at the DNA, they can tell that. So we've had in many states, including Kansas, we have had some cases that shows that maybe somehow the same virus that was affected dairy cattle, but again, it's probably the movement of people and equipment that took it from a dairy farm to a poultry farm. So that is happening. So biosecurity for all different industries are really important. Just because it's a poultry farm and you're a dairy farm doesn't mean you can suddenly share equipment or people without following the appropriate biosecurity.
Next question. With the virus in dairy cattle, could it be spread to dairy goats?
That's another good question. I don't know. I'm surprised we maybe haven't seen it already. I think it's certainly possible, but we haven't seen it yet. I think it would take a lot of close introduction to get there. So if an operation had dairy cattle and dairy goats at the same farm, that would be pretty high risk. We do think dairy cattle, some cases, it's being spread throughout the dairy in the milking parlor. So it's because there's not much of a respiratory component. We actually think that the biosecurity in the milking parlor actually going into the teat, kind of like mastitis, is transferred, is actually how it's getting into many of the dairy cattle, probably not all. So that would certainly be something to be having really good biosecurity if you had dairy goats.
Okay. Next question is, how long are the CVIs good for?
So they're good for 30 days. But the thing to remember is that, well, let me rephrase that. So we have a permit requirement as well. So is it really only going to be good for 10 days from the time, because the certificate of veterinary inspection is good for 7 days, but then we have a permit requirement that's good for 10 days. But talk to your veterinarian. It's very confusing and I apologize, but they'll kind of understand the process. If you are traveling across state lines, though, that test has to be done within 7 days. There's a lot of different numbers. Your best bet is try to get that within a week of the movement and have your veterinarian come out for that CVI.
Okay. Next question, is there a treatment?
There isn't. With dairy cattle, they seem to be recovering supportive care. They're certainly getting pulled out into the sick pen and being treated separately. So, and they do appear to be recovering. With poultry, there is no treatment, and unfortunately, most of them in the flock do die.
Okay. The next question is, the question is, what do we need to do for the poultry at the county fair to be safe? I'm going to expand that to our other species because I know I've got several extension agents on here and they've reached out to me before asking what additional precautions need to be taken at county fairs for other species.
Anytime, at any type of county fair, I think the most important thing is do not bring sick animals or animals from a sick herd or a sick flock to a county fair. It doesn't just have to be avian influenza, but that's a very high risk. So making sure only healthy animals are coming to the fair. The other thing is that biosecurity of just not sharing water buckets, not sharing equipment, any type of that type of sharing is a higher risk. So trying to keep a little bit of separation of not using the same water bucket for your animals and then taking it to a friend's animals. So those are some really big things that I think most fairs can do. The other thing that can be done, and I mentioned it, some states who are currently in active outbreaks are having cases, they're requiring a test before animals, even within the state, before animals can go to a show, especially if you don't have much options as far as sharing milking equipment. So they're saying, you know what, every animal coming to our fair have to have a negative test in the milk before they can come. So that's something we're certainly not requiring in the state, but that is something that if the show organizer wanted to do, or the extension agent, you could certainly do that if you choose. We We do have, and that's why we have that certificate of veterinary inspection requirement in, is because we just want someone to take a look at the entire herd and verify that everything looks healthy in those dairy cattle before they're moving off that farm.
So you would recommend, some fairs have a water tank that allow, multiple species, and, multiple animals to use. Your recommendation would be to not use those this year, correct?
That is correct, yes. And if I was taking my own animals, I'd bring my own water bucket because I would not want to risk it.
Okay. Next question is there any reduction of the virus in milk by pasteurization?
Absolutely, yep. So they've done all kinds of studies as they're learning, and pasteurization is still effective, and it will kill the virus as well as many of the bacteria that's also found in milk. So pasteurization is effective to kill the virus.
Next question is, what about all other lactating animals like beef cattle? Are there other restrictions coming down for them?
None at this time. We've not found this virus in beef cattle, and we have no restrictions. Doesn't mean something could change as we learn more, but nothing at this time. I don't see anything coming.
And are there any risks for swine?
Um, I guess there's always a risk for swine. Swine certainly are more susceptible to influenza than the other species. So the same precautions that I would take with the dairy cattle, not sharing buckets, those type of things, I would certainly do for swine as well. We have not found this virus in swine, but certainly other influenza viruses, different types, certainly affect swine. So there is certainly always a risk with any people and livestock because diseases can be spread between them. But at this time, we have not found this virus that's affecting dairy cattle and affecting poultry. We haven't found it in swine.
And does the virus affect eggs?
So it could. So if we have HPAI in poultry from the flock, all the eggs of the affected flock we do destroy and doesn't enter the food chain. We do find as far as the process, if you incubate and all the eggs, that heat will kill that virus on the outside of that egg. So, but we do not allow any eggs from an affected flock to enter the food chain.
And so because of the way the virus affects the flock pretty severely and you have a death loss pretty quickly, you would, if it's a backyard flock, you would probably know that you've got influenza or HPAI and not should not consume those eggs from your backyard flock as well. Correct? Okay.
Exactly. It's the influenza HPAI in poultry is not something that you miss. Your birds, unfortunately, they will be dying rapidly. So you know when you have it.
Mhm. Could the virus spread to people if consumed? I assume she's asking if milk is consumed with the virus in it, could the virus spread to people?
Possibly, that we do highly recommend the milk is pasteurized and not drink any raw milk. We actually have seen this virus in actually in 4 known cases spread to people. One was an individual who assisted in a response at a poultry farm, and they found the virus when they swabbed his nose. They found it in the nasal passage, not much for illness. They have found this virus actually in 3 dairy workers. They are actively looking for it in dairy workers. So it's not something that people are showing up in the hospital. They are going to as many workers on a dairy of affected herds as possible and just swabbing to try to find the virus to learn. So they have successfully found it in 3 workers. 2 of them just had pink eye. Those were their only signs. And 1 had a little bit more of a respiratory flu-like symptoms. 2 individuals in Michigan and 1 in Texas. So we do know it can spread to people. At this time, it seems to only go to 1 person, other members of the household. It hasn't spread past that person. And so far, and we hope it continues to be this way, very mild signs of illness.
Thank you. Next question is, if you get the virus in your flock, what do you recommend using to disinfect your coops?
So, cleaning and drying it out, a bleach type solution, most disinfectants will kill this virus. The most important thing is remove the organic debris, get all that removed and let it completely dry out. And that will, and outside, if it's an outdoor pen, the sun does an amazing job of disinfecting viruses. Heat and sun both do. So today it would have been completely gone. So those are the biggest things. If we have a backyard flock that gets infected with HPAI, and because of the coop, and often it's during the winter with migration, we require them to set empty or fallow for 120 days before we allow them to restock, just so we don't introduce new birds into that environment.
Thank you. The next question hinges off of one of the previous questions. How are pink eye and avian flu connected? Aren't they two different viruses?
So the signs that a worker had when they were, so public health officials are going to talk to dairy workers and they're just swabbing around their eye, their nose, their mouth, just seeing if they can find this virus as they're learning. So it was actually, there could be a pink eye with a different virus, but there was redness of the eye. They just swabbed it and they found that virus in it. So it was that virus in the eye. And it was a red eye, so I called it pink eye.
Thank you. All right. Any other questions? Looks like that might be it. Dr. McReynolds, thank you so much for your time tonight and for sharing your expertise with us. We will be sure to post tonight's video for your replay at your leisure on the Kansas 4-H Animal Science webinar webpage. If you've got additional questions for Dr. McReynolds, you're welcome to email them to me. My email is at the beginning of the chat, and I'd be happy to forward those to her for you. And if you have any other questions, be sure to reach out. With that, we'll go ahead and sign off for the evening. And Dr. McReynolds, once again, thank you for your time.
You're very welcome. Thanks, Kelsey.
Thank you.